Hi everyone, if you're watching this video, it means you've decided to move forward with a tonsillectomy and possible adenoidectomy based on your surgeon's recommendation. What I want to do is walk you through what happens the day of surgery and what you can realistically expect from the process. So, on the day of surgery, you'll come to the surgical facility and meet the nursing team first. They'll ask general medical questions, review medications and allergies, and go over the plan for the day. Depending on the age of your child and the facility, an IV may be placed before surgery. For many younger children, anesthesia starts with a mask first, and the IV is placed once they're asleep. You will then meet with your surgeon, who will confirm the plan and answer any questions you may have. Next, you will meet your anesthesia provider, who will walk you through the anesthesia process and what to expect. Anesthesia will then take your child back to the operating room. In the room, there's a full team, typically a circulating nurse, anesthesia staff, a surgical technician, and the surgeon. These staff are trained in working with children and make it as stress-free and comfortable as possible. The anesthesia provider helps your child fall asleep with laughing gas, and then an IV is placed. A breathing tube is then placed through the vocal cords to help protect the airway during the procedure. The procedure itself is usually fairly quick once we start. Timing can vary, but typically takes between 10 and 15 minutes. After surgery, your child will go to the recovery room. There, nurses monitor breathing, comfort, and overall stability. Typically, while your child is in recovery, your surgeon will come speak with you to let you know how everything went and review the key post-op instructions. When your child is felt to be awake and stable, they are reunited with you. You are then given further post-operative instructions before you head home. Now, the fun begins. I jokingly like to say that the surgery is the easy part. The next 2 weeks are the hard part. Pain management and hydration is the goal. In regards to medications, prescriptions are often sent in advance, or they may be sent the day of surgery. Many families pick them up on the way home or shortly after arriving home. Pain is variable from child to child, but successful management typically occurs with close monitoring and alternating medications like ibuprofen and Tylenol. I strongly recommend cold items like Popsicles and ice chips for several days, as they can help decrease swelling and associated pain. Topical numbing products are also often prescribed, which can be very helpful. So that's the overview of what to expect with a tonsillectomy and adenoidectomy procedure. If you have questions leading up to surgery, contact your surgeon or write them down and bring them with you the day of surgery. Our goal is for your child's surgery to be as safe and smooth as possible. Thanks for watching. I like to say, now you knows. Please check out other related videos to help with the recovery process.